What is diarrhea? Diarrhea is loose, watery stools, bowel movements. You have diarrhea if you have loose stools 3 or more times in one day. Acute diarrhea is diarrhea that lasts a short time. It is a common problem. It usually lasts about 1 or 2 days, but it may last longer. Then it goes away on its own. Diarrhea lasting more than a few days may be a sign of a more serious problem. Chronic diarrhea, diarrhea that lasts at least 4 weeks, can be a symptom of a chronic disease. Chronic diarrhea symptoms may be continual, or they may come and go. What causes diarrhea? The most common causes of diarrhea include bacteria from contaminated food or water, viruses such as the flu, norovirus, or rotavirus. Rotavirus is the most common cause of acute diarrhea in children. Parasites, which are tiny organisms found in contaminated food or water. Medicines such as antibiotics, cancer drugs, and antacids that contain magnesium. Food intolerances and sensitivities, which are problems digesting certain ingredients or foods. An example is lactose intolerance. Diseases that affect the stomach, small intestine, or colon, such as Crohn's disease. Problems with how the colon functions, such as irritable bowel syndrome. Some people also get diarrhea after stomach surgery, because sometimes the surgeries can cause food to move through your digestive system more quickly. Sometimes no cause can be found. If your diarrhea goes away within a few days, finding the cause is usually not necessary. Who is at risk for diarrhea? People of all ages can get diarrhea. On average, adults in the United States have acute diarrhea once a year. Young children have it an average of twice a year. People who visit developing countries are at risk for travelers' diarrhea. It is caused by consuming contaminated food or water. What other symptoms might I have with diarrhea? Other possible symptoms of diarrhea include cramps or pain in the abdomen, an urgent need to use the bathroom, loss of bowel control. If a virus or bacteria is the cause of your diarrhea, you may also have a fever, chills, and bloody stools. Diarrhea can cause dehydration, which means that your body does not have enough fluid to work properly. Dehydration can be serious, especially for children, older adults, and people with weakened immune systems. When should I see a doctor for diarrhea? Although it is usually not harmful, diarrhea can become dangerous or signal a more serious problem. Contact your healthcare provider if you have signs of dehydration. Diarrhea for more than 2 days, if you are an adult. For children, contact the provider if it lasts more than 24 hours. Severe pain in your abdomen or rectum for adults. A fever of 102 degrees or higher. Stools containing blood or pus. Stools that are black and tarry. If children have diarrhea, parents or caregivers should not hesitate to call a healthcare provider. Diarrhea can be especially dangerous in newborns and infants. How is the cause of diarrhea diagnosed? To find the cause of diarrhea, your healthcare provider may do a physical exam, ask about any medicines you are taking, test your stool or blood to look for bacteria, parasites, or other signs of disease or infection, ask you to stop eating certain foods to see whether your diarrhea goes away. If you have chronic diarrhea, your healthcare provider may perform other tests to look for signs of disease. What are the treatments for diarrhea? Diarrhea is treated by replacing lost fluids and electrolytes to prevent dehydration. Depending on the cause of the problem, you may need medicines to stop the diarrhea or treat an infection.